One of the most difficult decisions that my clients have to make is whether or not ultimately to have a surgery following any type of injury that they incur. If you know me well, you know that about 3 weeks ago I had back surgery. It was my third back surgery. And y'all, I was as nervous as anybody would be going into that. It ultimately had gotten to the point where I knew that I had to have it done. I knew that I could not accept living life, one, not being able to sleep more than 4 hours at a time, and that I just couldn't live in persistent pain the way that it was. Things aren't perfect after the fact, but they are dramatically different than they were before. And certainly, it was at a point in my life where I knew that I had to get it done in order to try to get better. And ultimately, I'd been through that before, and things were sort of predictable in the way that they shook out for me. The coronavirus, in some ways, was sort of a blessing, because but for it, then I probably would have, a week after the surgery, returned to work and just started doing my regular thing again. So it gave me some time to recuperate in a way that I would not have taken otherwise. But I want to talk a little bit about, in sort of a series of videos, first what happened to me. I don't have any sort of traumatic event that really triggered this in me. I just got a defective back, as it turns out. I was doing some things at the time, but they were healthy things, and I was trying to get in better shape, and that probably is what triggered it. Who the heck knows whether or not it would have happened otherwise anyways. But I also did some things after the fact that helped. They didn't give me the kind of relief that I ultimately wanted, and they weren't long-term solutions, but for some people, they're the kinds of things that may work. So I certainly want to talk about those a little bit. And then I want to talk to you about how it was that I ultimately arrived at the decision to have surgery, because it was something I truly did struggle over. I went from oral steroids to an injection with steroid and cortisone to help with pain. And then I waited it out for a period of time. I went through physical therapy, and probably I waited a little bit too long to have it done. That probably has cost me a little bit after the fact as well, and I'll talk about that. But it was a decision that I really struggle with, and I know that if you're dealing with a kind of injury that's persistent and really affecting your life, that's a really tough decision. I want to talk to you about how it was that I arrived at the decision to have surgery. So I will follow up in the next couple of videos and talk more about that at length. So if you have any questions, feel free to call me. My name is Ben Sessions. My phone number is 470-225-7710. Again, 470-225-7710. Thank you.